And welcome back, everybody. Thanks for sticking with us. We're joined by Jamie Oot and by AnnMarie Mesick. AnnMarie and Jamie. We'll shake hands later.
All right.
I just wanted people to know who you were. And both from Upstate Family Health Center.
Mm-hmm.
And let me start off with you, Jamie. For those who aren't familiar with the health center, what is it all about?
So we are a primary care provider. We have a team of providers and physicians and clinical staff.
And is this for low-income people?
It's for everybody.
Mm-hmm.
Yep. And we see the whole gamut.
Is it for people who can't get a doctor, don't know how to get a doctor?
Sometimes I know in the area there's a shortage of primary care providers that are accepting patients currently.
Mm-hmm.
So we are accepting new patients, but we are accessible for everybody regardless of the insurance.
Yeah, you talk about that a little bit if you would, AnnMarie. You're the clinical manager?
Yes, sir, I am. So we're a federally qualified health center, meaning we see those individuals that a normal primary care office wouldn't see.
For an example,
they are low income. They suffer from the social disparities of health, the social determinants of health, if you will. Low social class. They've been kicked out of every other doctor's office for non-compliance. We don't turn anybody away.
What would non-compliance be?
So you're a diabetic and you don't want to take your medicine, or you don't want to follow a special diet. You know, you have high blood pressure. You want to drink your sodas and eat your French fries from McDonald's, right?
Mm-hmm.
So that's all going to raise your blood sugars and your blood pressure. So
Mm-hmm.
it's not going to keep it under control.
So they ask not to see you anymore?
Some doctors will do that, yep.
Yeah. And what about the ages are we talking about here, Jamie? Are we talking from children on up to seniors?
We do. We see peds all the way up to seniors,
Mm-hmm.
yes.
And you've got a new building.
It's a brand new building.
Yeah.
So we just moved in about 3 years ago. And it's over 10,000 square feet,
Mm-hmm.
so we can see a lot of patients. There's 13 exam rooms.
Mm-hmm.
We have an on-site lab and also an on-site pharmacy as well.
Uh-huh. Where does the money come from for this new building? You're renting over there, I guess, aren't you?
We are renting. Jamie can talk to that.
Yeah, so we are renting currently,
Mm-hmm.
and that's...
Where does the money for the organization come from? Do you do fundraisers? Are you...
We haven't really done many fundraisers. A lot of it comes in revenue for patient visits,
Mm-hmm.
but we're pursuing grants and that route.
Yeah. And the people that you see as the clinical manager, did I get that title right?
Yep,
Clinical
clinical
manager. Is it like you oversee the people that are coming in and you assign them to doctors?
Well, I don't necessarily assign them to doctors. So if we have, when we get new patients, all of our providers are accepting new patients. They're assigned. If they have a request, I want to see, this provider, that provider, they do it. I oversee how the clinic is run from the clinical standpoint, as far as nursing staff, and that.
And are you an RN?
I am an RN.
Mm-hmm. I'm curious, what is this ribbon?
Oh, this is so we have a provider that's very interested and passionate about hepatitis C.
Mm-hmm.
And so she is spearheading hepatitis C treatment in our clinic, and this happens to be a hepatitis C
okay.
ribbon, yes.
Community Day, you've got a Community Day coming up, Jamie. What's that all about?
We do. So our Community Day is on August 9th. It's from 12 to 5 right at our health center. We have a lot of vendors that are going to be there, community resources and other resources, as well as tours of our health center that day.
Mm-hmm. And the people that can come over there for that tour, do they have to sign up? Do they just show up?
Nope, they just show up. It's a free event for all ages. We'll have something there for everybody. Some food vendors and ice cream trucks, popcorn, cotton candy, so something for everybody.
And the reason for doing this is what?
It's for actually National Community Health Center Week. So we're just celebrating as part of that. But we also want to bring awareness to our health center and the services that we offer to the community.
AnnMarie, are many of the people that you see at the center people that would, well, tell me if you disagree with this phrase, fall through the cracks of medical services?
I 110% agree with you. They do fall through the cracks. They're a very demanding population. They're the ones that go to the emergency department regularly. We try to stop that. We say, please come and see us before you go to the emergency room or urgent care. Just walk in. We want to, we want to control your blood pressure. We want to control your diabetes before you go to the emergency room.
And what about people that are making a healthy income? Would they be somebody that you would not want to see over there?
No, absolutely not. We accept everybody there. In fact, most of our board members are consumers of the health center.
And I was looking at your website the other day, and I see you've got, what, 2 doctors on staff over there?
We do. We have 2 doctors, and we have 6 nurse practitioners. We have 2 offices, one in Utica and one in Rome. And we also are embedded in 3 of the local elementary schools, Donovan, MLK, and Kernan.
Yeah, I wanted to ask you about that. I saw that on there as well. What's the purpose of that? What's the purpose of being embedded in those schools?
Yeah, so the reason for those health centers in the school is so that the kids can stay in school, they can continue their education, they can get the health care that they need, the parents can stay at work. It's a lot of time off, to take off time to leave work, go get your child from school, bring them to the doctors, they're sick. We have nurse practitioners that can treat, that can let them lay down and evaluate and then treat them as needed.
Yeah. Before you got into and for those, I'll try to orientate people, you would be right off the arterial over by Noyes, Oswego, right in there, correct?
Yep, we're right in between Noyes and Oswego Street.
Where were you before that?
We were not. We opened 3 years ago.
Just okay.
So,
What was the thing that caused it to happen, that caused this organization to be created?
So we're actually an offshoot of Upstate Cerebral Palsy. But we pursued our federally qualified health centers, so we had to separate. So that's kind of where that was an offshoot.
So somebody must have saw a need for this, huh, AnnMarie?
We are the best kept secret, we say, in Utica, right? There wasn't a lot of providers in that area, and so yes, we are your best kept secret, and there is a big need for it.
What are the people that avail themselves of the tour on, what was the date again?
August 9th from 12 to 5.
What are people going to actually see on the tour, Jamie?
So we'll give them a tour of our, it's a brand new state-of-the-art facility. They'll get to meet our support staff that we've got there and just get a little idea of what we're about down there.
Yeah. Do you have something involving art coming up in the fall, am I thinking?
So what you're talking about is we partner, we have a contract with Munson William Proctor Art College, Pratt. So what they start in the fall is they have we take the freshmen and sophomores of that program, and then as they go on, juniors and seniors will go down to New York City, the Pratt College of Art down there.
Oh, okay.
Yeah.
And the partnership kind of a thing, Jamie, that's, somebody told me once, and I agree with him. He came into town as for a not-for-profit. This is a non-for-profit as well, 501c3, correct?
Yep.
He said the first thing he does when he comes to town is partner up with people. He said that's the key, is to be partners with people. Yes?
It really is so important because there's so many nonprofits, so many resources within the Mohawk Valley area that need to work together. So the partnerships are priceless.
Yeah. Are you seeing, AnnMarie, in the 3 years that you've been open, are you seeing the people that you're serving, the numbers going like this, going like this, going like this?
So I will tell you that I've been there since January, and since January we have seen the numbers climb up to 900 new patients. So we also do refugee physicals. When refugees come into the United States, they need a health assessment within 30 days. We are one of 3 clinics in the area that provide that service for our community.
I know somebody that is in the family way, as they say, and she had a hard time finding somebody. Would that be something that she could have, she did find somebody, but Would that have been someone that you would have seen over there?
We would have seen and probably referred out as needed, yes, sir.
And do you, when somebody comes in to avail themselves of your services, do you find that sometimes you have to send them elsewhere?
If it's for a specialty that we don't provide, yes. So we don't provide cardiology, we don't provide, OB services. So yes, we would refer them out.
Okay. Give us the time, the date, and the place of the community day.
So it's August 9th from 12 to 5 at 1001 Noyes Street in Utica.
All right, so you get right off the arterial on either, the one-ways get a little tricky over there if you're going north or south, but it's in the Pugliese exterminator place, and there's an auto parts store right there.
Yes, our health center takes up the entire back half of that building.
Okay, good. Well, good luck with the community day. Maybe I'll come over and take a look around
Absolutely.
myself.
What do you
Love
mean
to have
maybe? You
you.
should come. Just come on by.
Okay, good. Good to see you, ladies.
Thank you.
Continued success.
Thank you.
When we come back, we're going to be talking to Dr. Mark Montgomery. He's from Joseph's Experience. We'll tell you what that's all about. Short break, right back.